guys, welcome back to my channel. So in the part 1 of this video, I have talked about endo department, pedo department, oral surgery, perio and prosto. So in the part 2 of this video, I'll be talking about ortho department. Then I'll be talking about public health dentistry, oral medicine and radiology, and I'll be talking about oral pathology. Now, starting with ortho department has a lot of money making. Every time you're making in every visit, you're going to take money from the patient, and it is very good for consultancy because ortho department is such a branch that no other department can tackle what you are doing. Obviously, with Invisalign coming into play, obviously many other dental practitioners are also doing braces treatment. Obviously, but again, braces treatment. But again, these are very minor and simple cases. And also if you're very passionate for ortho, then ortho is a very good department, a very money making department. So when I was undergoing counseling, one of my teachers told me that there is like so much of saturation in the market, large number of orthodontists in the market, and there is saturation. And most clinics, they do not prefer a freshers orthodontics, rather than they are already adapted to their orthodontist who always keeps on coming, because like it happens now, like some kind of adaptiveness. But again, that also depends on places to places. Like I am from Arunachal Pradesh. In my area, where I stay in my district, there is only one renowned orthodontist who is working in 3 to 4 districts, and we have lack of orthodontists in our place. I think in the area of northeastern areas, obviously we have lack of many specialized department in dentistry. Like I've told you, that it also depends on places to places also about the saturation. But otherwise, it's a very good department. And also for orthodontic surgery, as an oral surgeon, we can't do any planning. We can't do orthodontic surgery. The planning of the orthodontic surgery planning is done by an orthodontist only. So it is so much required in terms of orthodontic surgery. Also, they play a very great role in orthodontic surgery. Also, they tie up with plastic surgeons whenever they need help. And because plastic surgeons are also doing orthodontic surgery. And so now coming to the colleges for ortho department, so if you're going to choose a college, it's very important. You need to inquire whether there is high amount of patient flow or not. So you need to see to it where the college is located. If it is located in a very rural area and where people are definitely not interested in ortho, then obviously it's a loss. But so it's important to see whether there are high amounts of patient flow. Everybody wants to have a beautiful smile. So I think this department is so much significant in terms of aesthetics, in bringing back the confidence of a patient when they smile. So with a beautiful smile comes a beautiful face. Obviously, if you're not charming, you're not smiling. So I think this is a very good department. Now coming to the non-clinical departments, when I was pursuing my BDS, I was very good in theory. If I used to get A++ in Viva, I used to get C minus in carving. So I wanted to join a non-clinical department. But then again, when I underwent counseling, I changed my mind. This is not something to discourage you. Obviously, if you're very passionate about non-clinical, then definitely you should go for it. When I went for counseling, directly the counselor told me that like he wouldn't advise anyone to take up non-clinical branches. But again, as I've said, that it depends on your passion. If you have knowledge about the market value, and if you're still passionate about something, then definitely you should go for it. Because if you will see any kind of TED talks or any kind of successful story talks, people will always be like, they told me not to go there. ऐसे नहीं करने के लिए बोला था, but फिर भी मैं गई, and then today I'm a successful person. So it depends on person to person also, like what you want to do in life, what is your interest in life, what is your passion in life. So for me, market value was more important than passion, and ultimately, obviously, I took up oral surgery and I fell in love with oral surgery. And after it, I felt like I was meant to be an oral surgeon only. But I remember talking to one of my juniors and I asked, which department do you want to select? And one of my junior told me that I think, boss, I can give justice to any department. So I think if you think that you can give justice to this department, and if you think that your passion is so important, then definitely you should go for non-clinical subjects. Now coming to public health dentistry, I cannot say that this department is a non-clinical department also. You are in touch with the general dentistry. I have seen my seniors, those who were in public health dentistry department, they used to do RCT, they used to do fillings, they used to even do crown cutting. They used to take it up as a part-time, and they used to have some clinical days. Among 7 days, they used to do, I think 2 or 3 days, they used to do clinics in the department. So it's not exactly a non-clinical department also. I mean, if you want to go abroad, then it's a very good department for UNESCO, for UNO, for public speaking, for educating the patient. You have that passion to educate people about dentistry. It's a very good department. And also HODs of public health dentistry gets the highest amount of salary among all the HODs. And yes, also there are lots of theory. If you're very good in maths, then this subject is definitely for you. Again, biostatistics is a part of public health dentistry. Nobody told me about this when I was undergoing counseling, but this is from my own personal experience. You cannot complete your thesis without the help of a public health dentist. When you're doing those biostatistics, you're undergoing the result of your thesis, then you will need the help of a public health dentist. And you have to pay around 4,000, 5,000. And for me, it was like, wow, since I am a very lazy person, I was like, wow, ghar bete bete, like statistics solve karo. Obviously, you're in love with statistics. So I heard from one of my PG who's pursuing her anesthesiologist that people are doing statistic calculation, public health medicine, and they're even buying houses. And they're making all those ready-made LDs, and they're charging 15 to 16,000. So I never knew about this, seriously. That's why I'm just telling you in this video. And obviously there are limitations to clinic because you're not particularly specialized in a particular department, but to be very honest, logically speaking, I think actually there's no requirement of MDS also. If you are very good in your general practice, so many dentists are doing wonders in their dentistry field. Now coming to oral pathology, I think you are going to have vast amount of knowledge if you are going to go for oral pathology, and it is more theoretical. Obviously also all the specimen ultimately, after taking biopsy also, when you're performing surgeries, biopsies, ultimately to reveal a diagnosis, obviously we need a help of an oral pathologist. Every department has got its own importance. So for research also, for abroad, if you want to do more research, more PhD, then definitely this subject is very good for academics also, because there are more number of subjects, like you have DADH, you have oral pathology, you have general pets. So it also covers more number of subjects in your first year, second year, and the third year BDS. You can still undergo general practice also along with oral pathology, because what happens as a clinician, if you are joining a clinical department, you become very obviously very overconfident. But if you are joining a non-clinical department, you are allowed from day one. Day one, you start working hard. You can keep a good relationship with other department PGs. You can learn infection from oral surgery PGs. You can learn crown cutting or everything from other departments. Keeping in touch with them, you can still continue with your general dentistry practice. So ultimately, as I'm saying again and again, hard work is the ultimatum to everything. If you're going to join oral medicine and radiology, definitely it is more bookies, it is more theoretical. And if you are a radiologist, definitely you can open your own radiological center if you have the money for CBCT, for MRI, OPGs. There is so much lack of this, because it is very difficult to read the radiograph for MRI. I had a thesis on TMJ myself, but every time whenever I read the MRI, I feel like my brain goes up somewhere, and I can read the report at 6 o'clock, 12 o'clock TMJ position, but nobody can read it better than a radiologist. Yeah, I've seen many of my senior professors, they do not know how to read MRI. So obviously, if you are a radiologist and if you specialize in this field with all the passion that you require, if you're going to give justice to this brother, then definitely sometimes it is very difficult to diagnose a case. Yes, it has happened. It has also happened in many institutes that there is a wrong diagnosis. The patient has undergone all kinds of surgeries, and at last they are realizing that the diagnosis itself was wrong. So obviously, for diagnosis and radiological purpose, help is required. You can also work as a consultant. There will be limitation of consultancy, but consultancy you can work as a consultant, and there are not much scope. If you feel that you cannot give justice to this department, you cannot excel, if you cannot stand out in this department, then it's okay waiting a year. If you're going to join an OMR college, make sure that they have CBCT in their college. Ask about it, whether they have CBCT or not. Now that comes to the end of my video. And I forgot to talk about mental health also, about your situational status also, because sometimes if you cannot take so much of mental load, as for me, I cannot take mental load much. So I'm very fortunate, and I'm so blessed that I did my oral surgery from GDC Jaipur. I feel like it's the coolest department and the best department. That is my own personal feeling. So I think that also matters a lot. So I hope this was of some help to you. Thank you so much guys for watching my video. Please do like, share, subscribe and comment. It will be very grateful of you. I'm saying this again and again because I'm shooting this video at a temperature of 45 degrees Celsius with no air conditioner and just a fan, that also with a very low volume, so that there's no disturbances of this sound, and in a compact room where all the doors are closed. Thank you so much.